Everything you need to know about all hypothyroidism. Signs, symptoms, causes, treatment or hormones play a vital role in maintaining our body's complex balance and managing communication between different body systems. Of these, thyroid disorders stand out as some of the most common in the field of hormonal disorders. Whether you are familiar with the symptoms or not, understanding thyroid disorders is essential to recognizing and managing their health effects. Thyroid disorders include a variety of conditions that affect the thyroid gland, a small but powerful organ in the neck. This gland produces hormones that regulate metabolism, energy levels, and many other vital functions. Dysfunction of the thyroid gland, which produces too much, hyperthyroidism, or too little, hypothyroidism, hormone, can cause a variety of symptoms that affect daily life and long-term health. In its comprehensive guide, we delve into the complexities of thyroid disorders and explore their signs, symptoms, causes, and treatment options. From subtle signs that can go unnoticed for years to more severe symptoms that can seriously affect quality of life, we cover it all. In addition, we discuss factors that cause thyroid dysfunction, including autoimmune diseases such as Hashimoto's thyroiditis and Graves' disease, as well as environmental and genetic influences. Understanding thyroid disorders isn't just about recognizing symptoms. It's about having the knowledge to effectively communicate with healthcare providers, navigate treatment options, and make informed lifestyle choices that support thyroid health. Whether you're struggling with symptoms yourself, supporting a loved one through diagnosis and treatment, or simply looking to expand your understanding of endocrine health, this guide aims to provide clarity and practical knowledge. Before diving into the specifics of hypothyroidism, hyperthyroidism, and related diseases, subscribe to our channel for news and expert advice on managing your thyroid health. Stay informed, stay active, and together we'll explore everything you need to know about thyroid disorders. Your journey to understanding and managing your thyroid health begins here. Let's start this informative journey together to make sure you have the knowledge and tools you need to understand your thyroid disease. This type of disorder is a direct cause of hormone transmitter dysfunction. According to the National Institute of Diabetes and Digestive and Kidney Diseases, the most common are hypothyroidism, which affects 4.6% of the U.S. population, and hyperthyroidism, which affects 1.2%. Before we start this video, don't forget to subscribe to our channel for more daily tips like this and turn on your notifications so you don't miss any of our new videos. What is hypothyroidism? According to the Mayo Clinic, this condition means that your thyroid gland is barely active and that you do not have enough thyroid hormone in your blood. Hypothyroidism is also called hypothyroidism or hypothyroidism, and is classified as a disorder of the human thyroid endocrine system. It occurs when the thyroid gland does not produce enough thyroid hormone. This leads to a number of different symptoms. Symptoms can vary from person to person, but one clear sign is the ability to lose weight. In women over 60, hypothyroidism occurs much more often, which disturbs the balance of chemical reactions in the human body. In the early stages of hypothyroidism, symptoms are rare, but over time, and if left untreated, hypothyroidism can lead to a variety of different health problems. These health problems include obesity, infertility, joint pain, and heart disease. However, there are all kinds of accurate thyroid function tests that can diagnose hypothyroidism, and treatment is very safe and effective. When levels of thyroid hormones in the blood are low, many body systems slow down. So another Mayo Clinic symptom would be lack of energy, lethargic, and very easily tired. If your body does not have a functioning metabolism, which slows down with this disorder, it affects body temperature and people catch colds. A slow metabolism can also cause constipation, which is another symptom. Depending on the severity of hypothyroidism, symptoms develop very slowly and usually over several years. Symptoms such as fatigue and weight gain are not visible at first, but as a person's metabolism continues to slow, the more obvious symptoms of hyperthyroidism become apparent. These symptoms include increased sensitivity to cold, constipation, dry skin, fatigue, muscle weakness, and more. You may also notice that you have thinning hair, a slower heart rate, or even memory loss. Treated hypothyroidism can cause symptoms that worsen over time and can lead to an enlarged thyroid, forgetfulness, or even depression. Advanced hypothyroidism is called myxemia. Myxedema is very rare, but can actually be life-threatening. Symptoms include breathing problems, a drop in body temperature, low blood pressure, and unresponsiveness. In some very extreme cases, myxedema can be fatal. Hypothyroidism can also occur in infants. Newborns with hypothyroidism may have symptoms such as yellowing of the skin and the whites of the eyes, known as jaundice. Jaundice occurs when the baby's liver is unable to metabolize bilirubin, which occurs when the body recycles damaged or old red blood cells. Other symptoms include a large tongue, a swollen face, and frequent choking. As hypothyroidism progresses, babies may also experience feeding and developmental problems. They may also experience constipation and excessive sleepiness. Untreated, hypothyroidism can also cause mental and physical disabilities in babies if left untreated. Hypothyroidism in children and teenagers can also cause delayed puberty, poor mental development, delayed development of permanent teeth, poor growth, and more. Interesting, isn't it? Read on to learn more about hyperthyroidism, another common thyroid disease that affects people all over the world today. Hyperthyroidism. This hypothyroidism is the complete opposite of hypothyroidism. Hyperthyroidism means having too much thyroid hormone in the blood, says WAIND. How it affects metabolism also varies. Unlike hypothyroidism, this disease accelerates metabolism. People with hyperthyroidism feel extremely restless, anxious, and irritable because their system is overloaded, says WAIND. It can also cause sleep disturbances, and they can also develop muscle weaknesses. There are many different treatments for people with hyperthyroidism, such as thyroid medications and radioactive iodine, which slow down the production of thyroid hormones. In some cases, surgery may be necessary to remove the thyroid gland. The symptoms of hyperthyroidism are similar to many other health problems, so it can be difficult for doctors to diagnose. These symptoms include sudden weight loss, rapid heart rate, increased sensitivity to heat, trouble sleeping, fatigue, muscle weakness, and more. Older adults may not have any signs or symptoms. A common problem associated with hyperthyroidism is a condition called Graves' ophthalmopathy, which causes a person's eyeballs to protrude beyond the protective orbit. This happens because the tissues and muscles behind a person's eyes swell. Other signs of Graves' ophthalmopathy include red or swollen eyes, sensitivity to light, blurred or double vision, or excessive tearing or discomfort in one or both eyes. Cause of hypothyroidism. The most common cause of hyperthyroidism is Graves' disease, which is an autoimmune disease, and the most common cause of hyperthyroidism. This causes the production of antibodies that stimulate the human thyroid gland, causing it to secrete too many hormones. Graves' disease is much more common in women than men and is usually genetic. Other causes of hyperthyroidism include ovarian tumors, benign tumors of the thyroid or pituitary gland, excess iodine, large amounts of tetraiodothyronine from medications or supplements, and more. In some cases, these disorders are caused by the body's immune system attacking thyroid cells and their enzymes against invaders. This type of hypothyroidism is called Hashimoto's thyroiditis. Hyperthyroidism can be caused by thyroid nodules that grow and increase the production of thyroid hormones. WAIND explains. Identify and treat these conditions. If you or someone you know is experiencing any of the above symptoms, doctors will do blood tests to make sure your thyroid hormones are in range. The Mayo Clinic explains that treatment for thyroid disorders usually involves prescribing the synthetic hormone levothyroxine. Thyroid medications can also be used to prevent the production of your own thyroid hormones. Some key factors that play a big role are leaky gut, diet, toxins, infections, and stress. So when doctors suspect that the disease may be autoimmune in nature, they look at foods, especially gluten, and digestion. According to the Mayo Clinic, the thyroid gland needs several important nutrients to function properly. Thus, it is possible that correcting deficiencies in nutrients such as selenium and zinc may be a factor in treatment. Because of the integrated nature of the endocrine system, other hormones such as cortisol and sex hormones should also be tested, says the Mayo Clinic. In order for recovery to begin during treatment, it is important to address possible underlying causes. The doctor can help assess your current condition and give you professional health advice if you have been diagnosed with a disease or disorder. Most symptoms associated with hypothyroidism appear gradually, so they are often easy to ignore or attribute to other causes. It is very important to pay attention to your health and recognize subtle changes that may indicate thyroid dysfunction. Symptoms such as persistent fatigue, unexplained weight fluctuations, changes in skin texture, and facial swelling prompt a discussion with a healthcare provider. Early detection and intervention can significantly improve outcomes and quality of life. If you are diagnosed with hypothyroidism, your doctor will work with you to develop a personalized treatment plan. This may include medications to balance hormone levels, dietary changes to support thyroid function, and lifestyle changes such as regular exercise to improve overall well-being. Consulting a doctor, especially if you are elderly or have other medical conditions, will ensure the safety and effectiveness of your treatment regimen. Maintaining a nutrient-dense diet is essential for maintaining thyroid health. Consider adding foods that contain selenium, zinc, and iodine, which are important for thyroid function. Balanced diet not only supports treatment, but also contributes to your overall health and vitality. Sharing your experiences with hypothyroidism can be insightful and comforting. If you have a story to tell or advice to share, we invite you to join the conversation in the comments below. Your experiences can be encouraging and provide valuable insight to others on similar journeys. If you found this video informative and helpful, please show your support by liking and subscribing to our channel. Stay tuned for more educational content on thyroid health and other health topics. Thanks for searching and learning about thyroid disorders. Together, we can raise awareness and support the community to achieve better health outcomes. Remember that your proactive approach to thyroid health is important. Stay informed, stay active, and prioritize your well-being at every stage. Here's to better health and a brighter future.